Good morning, good afternoon, good evening, everyone from wherever across the world you are joining us for this very special conversation. A very hearty and grand welcome to each one of you. We apologize for our delay in starting. My name is Judith Johnson-Grant. I am an ordained Jamaican Baptist minister, and I have the distinct privilege of serving alongside Jason Paltzer, whom you will meet later on. And we both serve as co-chairs of the Integration of Faith and Health Working Group of the CCIH. For those of you who are joining us, who are new to CCIH, Christian Connections for International Health is a global network of Christian organizations and individuals committed to advancing health and wholeness, motivated by our Christian faith and values. This is the first of 4 webinars that the Integration of Faith and Health Working Group will host over the next year and a half, exploring the theoretical and practical aspects of how health and faith are interrelated across health disciplines. Today's webinar is co-sponsored by this working group and the Global Anabaptist Health Network. We are elated that you have joined us for this important conversation as we explore what is the theology of health and how does that apply to global health. Leading us off and guiding us throughout our deliberations is Amy Hewitt, one of our moderators for today. Amy serves as grants coordinator for grants acquisitions and management at Cure International, with more than 17 years of experience working in international development and global health. Amy focuses on long-term relationships, common interests with foundations, and managing and communicating the effectiveness of programs. She is very well able to guide us through our deliberations today. But before she comes to us, let us pray. Holy One, you are Alpha and Omega, beginning and end, beyond time and space, yet present in each moment and every place where we are. We celebrate your providence and direction in gathering this virtual community of faith to talk about something that is most important to you: health, wholeness, healing. We thank you for all who are gathered here and for how these conversations will impact our different ministries and vocations. Offer special insight to and through our speakers and our moderators, in and through the name of Jesus Christ, who is Lord, who lives and reigns with you and the Holy Spirit, one God, now and forevermore. Amen. Over to you, Amy.
Thank you, Judith, and thank you for such a warm welcome to our webinar. So let's get started here. Before we begin, there's just a few housekeeping comments, of course, to keep us all on the same page. If you look at the bottom of your screen, there is a Q&A box. We're going to use that for our questions. The questions will be at the end of the, after the speakers have talked. So you can put your questions in when you think of them, but we will get to the questions and answers at the end of the webinar. And also, this is being recorded. So today we will have 2 presentations followed by at least 10 minutes of Q&A at the end. Please, said that. So let's go ahead and introduce our first speaker. Dan O'Neill, MD, is managing editor of the scholarly Christian Journal for Global Health and founding board member of Health for All Nations. He has been a member of CCIH since 2007 and was co-chair of the Integration of Faith and Health Working Group. He practices medicine in Connecticut and serves as an assistant clinical professor of family medicine at the University of Connecticut School of Medicine.
Thank you, Amy. It's great to be with you all this morning, my morning. You know, the integration of faith and health is my life's calling. I seek to apply this integration as a physician theologian, practicing whole person care and medicine and pastoral leadership at the local level, but also serving and teaching and writing at the larger global scale. So I appreciate the opportunity to share with you and learn together. Well, building a theology of global health is important to motivate and to sustain our work toward health for all nations, which is the name of our organization. And I like this concise definition here: collaborative transnational research and action for promoting health for all. And so we look for common ground and universals for shared goals, and these shared goals are shared with others in the global goals. And so I want to look today about the universals and the particulars. As Christians, we share some unique features, values, and beliefs. Jesus came that the world may have life, abundant life. And health, as we see, is a part of the continuum of life. And we will also look at the particulars. These may influence common goals, but they also create some distinctives and some distinctions that we'll look at. So first, the issues. We all need to contend with the contemporary world, and our theologies answer the questions of why. And so we look at these issues that are contemporary. The first, pathology. Pathology really literally is the study of suffering, that we deal in intermediaries, material intermediaries of disease processes and disordered states of being, or even psychopathology. We look at deprivations or excesses and how these relate to the moral life and moral disorder in our world. We also see corruption, and we deal with this every day, aberrations in DNA and RNA sequences, which lead to death or enhanced virulence, or twisted ideas even, or false narratives, which oppose divine intervention and divine directives and oppose truth. Or we also see corruption in failed systems as well. And then there's depersonalization, which can be an overemphasis on programs, policies, and procedures, or technical solutions, and losing the person-centered micro-narrative among our languishing neighbors, global neighbors. Then we see reductionism, which is a legacy of our Enlightenment, which has brought us great progress, at the same time has led to the dissection of everything down to its constituent parts, or even super specialization, which creates professional and sectoral silos where we each speak our different languages. We also see system complexity, where we are each challenged by increased complexity in the digital age. And we have a tendency to create our own simplistic singularities, I call them. And when we have these singularities, we sometimes talk past each other. And that's true of the complexity of health systems, but also religious systems. And that creates a challenge for us. We also see the data overload in the information age. You know, it's given us lots of facts, but little guidance on how to apply it to the real world with wisdom, like Lady Wisdom from the scriptures. We also see competing voices, that the media storm and news feeds make it difficult to discern the voice of the Good Shepherd from time to time, and it does create divisions within and among us. And we also see secularization. And in biomedicine, we've been secularized for a long time. But the global health enterprise has also been secularized. Governments have been secularized, multilateral organizations, even the church has a tendency to become secularized. So that's an issue that we have to deal with. Also, tribalism sociologists have been tracing this turn of events in the recent past, creates division and often insular approaches to global problems. And in the Christian community, sometimes escapism or instead of engagement. We also see displacement, which not only about displaced peoples, which is a huge problem in the world, but also displaced core values from the Christian faith communities. So beyond becomes the opportunities that we have. So we move from the issues to the opportunities. And we see that the role of faith in medicine is a huge burgeoning evidence base that the role of faith has in medicine by Dr. Koenig and others, that religion is also a social determinant of global health, which is becoming more widely accepted in academics. If you read some of the works of Ellen Eidler and Doug Oman and Kate Long. Also, that health is a great global connector, which is the term that Kathleen Sebelius, the head of Department of Health and Human Services from the United States, used in 2014. But health itself creates an interest in collaborating and across denominations and across development sectors. We also see the presence of God's people globally, that Christianity has become a globalized religion with widespread presence, but not presence in every people group. We also see the opportunity to access the divine at the grassroots, that multilaterals and governments are realizing themselves that the top-down external programs are insufficient and that aid needs to be localized for equitable distribution and for local accountability. We also see opportunities with globalized theological reflection, that as the church has grown globally, perspectives and increasingly shared mutual learning have led to a fuller view of health and healing. And we also see that one of those is salvation being viewed on a wider scale, a richer, deeper view of salvation as creation healed. And this is starting to be picked up in Western theologians like Francis Schaeffer years ago and Howard Snyder more recently. And ultimately, the goal is transformational development, or using a New Testament word, metamorphosis. So we move from the universals that we see that there is one God, there is one world, and we're starting to understand more of an ecological understanding of the way humanity interacts with the rest of the created order, that there is one humanity, that there is a brotherhood and sisterhood of humankind, that we have common ancestry, and that all nations are on the heart of God, all people groups, not just nation states, and that nature and science birthed in the Judeo-Christian worldview is about a measurable universe that God created, and something that we can test and discover. And that also suffering is ubiquitous, that pathology transcends all boundaries. And even this most recent pandemic has shown us above everything else that there is mutual vulnerability no matter where we live, and that we're in this together. and that there is a universal need, and this transcends culture, denominations, and religions, that health, meaning, and love are something that people are seeking after. But as Christians, we look at the particulars as well, that there is one true God, that other gods are no gods at all, that idols really amount to nothing, and that the woman's seed from Eve in Genesis 3:15, that through though the serpent would strike the heel, that Jesus would crush the head. And that prophecy has borne out in history. That the chosen people, Abraham called in Genesis chapter 12 out of Ur to be blessed, to be a blessing to the nations. And that the holy nation was set apart, purified, and health laws that were developed in the Mosaic covenant were really foundational for modern day public health. So attributing that to God's revelation, I think, is important for us. And that the particular of the one Son, the one only begotten Son, that he was above all the prophets, and that we must listen to him. That we are also the called out, or the ecclesia, the church, the assembled of the redeemed from every nation, diverse but unified. And then the sent forth, that Jesus himself preached and healed, and he sent out the 12, then the 72, and ultimately in the book of Acts to the nations, to the ends of the earth. And that we are the healed, the sent forth, are wounded and healed healers, vice regents of God's healing intentions. Then we flip to common ground, that the goals that are shared by others that we share as well. Namely because we have influenced those common goals and because of common humanity. That we address inequities and poverty, that we pursue justice, that we seek the goal of global health for all nations, and as the SDGs say, to leave no one behind, and to follow the evidence in truth-telling, to move from collective, move through the collective, which means collaborating, and then reinforcing and supporting human rights because they are based on dignity, but we would add responsibility and also human wrongs, which people identify as an important cause of the problems of the world. We might call it sin, and how do we address it at its root? And we look at also effectiveness of results. And as I work with the moral imperative, the evidence working group, we seek to procure evidence about the outcomes. But the distinctives that we bring to the table are, as we mentioned, the importance of human dignity at every level, and that humility is a mark of the followers of Christ, servant leadership, and also followership. That there is long suffering and staying power, which I think the world has recognized, that Christians are often the ones that stay and go to places that of high need, and that there is a degree of self-sacrificial love that emerges from a church that is well-trained and well-discipled, and that the power is made perfect in weakness, and that joyfulness can be present despite deprivations and through illness. And we care for the most vulnerable, the least of these. And as recently late Paul Farmer found his hermeneutic generosity from Matthew chapter 25. So we look for hopefulness, for holistic transformation. And we could take an eschatological long view of a preferable future. And it makes all the difference. Having both a crucicentric or Christ-centered understanding of the world, but also a resurrection-centered idea, which gives deep hope. And so we move to synergy. Synergy is working within complex adaptive living systems, working with others of goodwill, that we connect with existing resources, moving towards symbiosis and not predation, that we move toward appropriating unforeseen power, and the Greek word is dynamos or dynamite, the power of God to overcome challenges, and we cooperate with the covenant community of any stripe, toward those ends that God seeks for healing and hope, and that we seek interdependent relationships.
Dr. O'Neill,
hmm?
we are getting, we have just a few minutes left for your presentation.
Sure.
So I just want to make you aware of that and see how you would like to spend, the rest of your 2 minutes.
Mm-hmm. Yeah, recognizing Messiah's ongoing presence and work, the assembly planted and mobilized, and minding the gaps. So looking for those gaps, those areas of greatest need that we can run into the breach. So that takes some discernment. We need to be careful with our alliances, and cooperate with people of goodwill. And as we cooperate and critique, we work cheerfully with the grain of goodwill, with people of all faiths or no faith, in the art of collaboration without compromise and of opposition without dualism. And as James Hunter says, the accommodation must always be critical and resistance must always be humble. And so as we integrate, we seek not to disintegrate, but to bring faith and action into our lives together collectively, as we seek to help people gain a sense of God's presence, as well as life abundant, on a continuum toward a preferable future, which we hold out the vision in Revelation 22. So thank you for your time and attention. I appreciate this opportunity. Back to you, Amy.
Thank you, Dr. O'Neill. A lot of very good information in there. I want to, again, remind everyone that this webinar is being recorded and will be posted on the CCIH YouTube channel and also on the CCIH website at www.ccih.org. Go to events and then webinar recordings, so you can go back and listen to more of Dr. O'Neill's presentation after today as well. You will also get an email with a link to the recording when it's posted. And now I'd like to introduce our next speakers. We have with us this morning Gabriella Wu, MD. She is a Nicaraguan physician and public health leader with more than 10 years of experience in on-the-ground work and partnership building necessary to reduce health inequities. Currently serving as the executive director of Fundación AMOS, Salud y Esperanza, AMOS, Gabriella firmly believes that health for all is possible when evidence-based, faith-based, and community-based models are combined to ensure that health services reach the most vulnerable members of our society. We also have with us Christy Lafferty. Christy is a global servant with international ministries, supporting the ministry of Fundación AMOS, Salud y Esperanza in Nicaragua. Following a strong call to cross-cultural ministry, Christy has served for over 15 years with faith-based and community-based nonprofits. Throughout her 10 years of service with AMOS, she has helped develop the organization's capacity to communicate the impact of its work, build connections, and establish effective partnerships with churches, individuals, organizations, and universities. I now turn it over to Dr. Wu and Christy Lafferty.
Good morning to all. Thank you, Amy, for the presentation, and thank you, Dr. O'Neill, for what you presented today. As you said, I am Gabriella Wu. I'm the Executive Director of AMOS Health and Hope.
And it's so wonderful to be with you all. I'm Christy, and I'm in supporting AMOS in communications and partnership development. As we said, serving with international ministries as a global servant. We're really pleased to be here with you all today and participate in this first webinar organized by CCIH and the Faith and Health Working Group. So as Dr. O'Neill outlined for his presentation, the scriptures are full of an emphasis on healing and the integration of faith and health. One example in Mark is when Jesus said, "Your faith has made you whole." The way that Jesus healed both body and spirit is a perfect example of where faith and health intersect. And at AMOS, Health and Hope, this is a fundamental value for the work that we do. Next slide.
We always like to start with some geography in case there is a viewer that is unfamiliar with where Nicaragua is. We are located in the heart of Central America, that small strip of land between North and South America, and we are a country about of 6.1 million people. Next slide, please. To share briefly about what AMOS is and does, we are a Christian nonprofit organization that seeks to treat disease, prevent deaths and of those most vulnerable, and strengthen communities for lasting change. Next slide, please. Our mission is to improve the health of impoverished communities by working alongside them in health, education, and development. Just because a community lacks of infrastructure and suffers from poverty does not mean they lack resources or an ability to address their own problems or needs. We serve more than 24,000 people in 5 regions of Nicaragua, and AMOS trains local leaders who help to improve access to healthcare where there is no hospitals or no health unit. We improve the access to medications for people who could not afford or access them. Also, we improve the access to clean water to prevent disease and promote health, and strengthen community empowerment so that people can improve their own health and well-being. Next slide.
So we are also first and foremost a Christian organization, and we have the conviction that God cares for the poor with a heart of compassion, healing, and justice. Next slide. So AMOS was actually founded through a call of faith to serve the Nicaraguan people with their health needs. Dr. Gustavo Parajon was a medical doctor and a public health pioneer. He embodied the intersection of faith and health by combining his medical training with a call to serve. He started his work as an American Baptist missionary in 1967 and founded the public health organization Providenic, whose model of work AMOS continues to build upon today. And Dr. Gustavo knew that the role of a doctor was not just to treat individuals, but to care for the well-being of communities. Next slide. AMOS has followed the vision that builds upon Dr. Gustavo's legacy and was founded in 2007 by public health doctors and American Baptist missionaries, David and Laura Parajon. AMOS focuses on the communities themselves, teaching local people to provide basic primary healthcare services and thereby dramatically reducing preventable illness and death. Next slide. So today, the AMOS staff under the direction of Dr. Gabriella Wu continues to strengthen this vision that is at the intersection of faith and health, with the goals of health for all people, a world where no child dies of a preventable disease, and healthcare that is both effective and empowering. And I also felt this call to serve as a young adult missionary, and today, working through international ministries, help to AMOS to safeguard its mission for the future. Next slide. So AMOS is an acronym that stands for a Ministry of Sharing, Health and Hope. Next slide. But also, like our namesake prophet, AMOS seeks to stand with the poor and the vulnerable, bridge the gap of health inequities in rural and urban communities of Nicaragua. And AMOS's community-based primary healthcare model seeks right and equitable relationships with people, no matter their social differences, and at the same time takes concrete actions to correct injustice to foster those relationships and healthy communities. Next slide. So health and healing ministries, we feel, are an expression of the church's mission. And as in this statement from the World Council of Churches, health is more than physical and mental well-being. And healing is not primarily medical. Health and healing were a central feature of Jesus's ministry and of his call to his followers, the reason why the church has been engaged in health services for centuries. Health and medicine are an extension and expression of the gospel, not counter to it. And any model for health is technical, yes, but is also based on taking the time to listen and put value to another person's or community's experience. And this is an expression of God's love. So I'm going to turn things back over to Dr. Wu, who will share a little bit more about how AMOS puts the work of faith and health into action.
Thank you, Christy. Our contexts call us to serve. Poverty is concentrated in rural areas where families still do not have their basic needs met, such as clean water, education, adequate food, shelter, healthcare. Next slide, please. AMOS responds to this reality with a health model that is community-based. Jesus chose and empowered disciples to share the good news to all nations and build a church. AMOS uses this example and strives to empower local people to address their own health needs and build health communities for the community, by the community, as a contribution to God's kingdom. The model is also census-based. Everybody is counted because everybody counts. God invites everyone to the table, and AMOS strives to ensure that people know they are worthy of quality healthcare and can be the protagonists of their health and well-being. Next slide, please. We also are evidence-based in the same way that God's revelation happens over time. Scientific discovery also builds on the work of past discoveries. AMOS carries out community-based participatory research, collecting data and input from communities to inform our work in healing and health. AMOS prioritizes the most vulnerable population, women and children, and those with chronic diseases. And finally, the model is partnership-based, following God's invitation to be co-creators of the kingdom of justice. AMOS seeks to bring together all the stakeholders for quality healthcare and mutually beneficial collaboration. Next slide. Concretely, we strive of a healthy triangulation of AMOS, the local community, and the Ministry of Health to work alongside communities toward their empowerment. Next slide.
So we were invited to this webinar to share about the practical experience of where faith and health intersect. And we have shared some about AMOS's model and the motivation of faith. And but what does that collaboration and community empowerment look like on the ground? We want to tell you a brief story told to us by Juan Pablo Perez, who is a health promoter in the rural community of La Danta in the South Caribbean coast region of Nicaragua, a remote part of the country, where a patient may walk for hours to reach any health services. This story evokes for us the story of the paralyzed man. Could you go back to the last slide? In Luke, who was lowered through the roof of a house by his friends who had faith that Jesus would heal him. Juan Pablo received an emergency call one night about a pregnant woman in the community. The woman needed urgent help. She had gone into labor and was trying to give birth by herself at a house some distance from the community clinic. She pushed with all her strength for hours, but nothing happened. She and the baby were at risk, but by this time, she could not walk on her own. The woman's brother called Juan Pablo to tell him what was happening, and Juan Pablo immediately activated the Emergency Transportation Committee and called the closest health center. Now, if you're wondering, the emergency transportation system is not an ambulance with paramedics, but a group of volunteers who come together to walk a patient out of the community in a hammock like the one you see in the picture. The government health service recognizes Juan Pablo's position as a trained community health worker and responded to his call by sending an ambulance to meet them at a certain point. In this story, it had been raining a lot, and the ambulance couldn't cross the river nearby to La Danta safely. When the transportation committee arrived at the river, they carefully placed the woman in a small wooden canoe, and she was taken slowly to the other side, waiting where the ambulance was waiting. When she arrived at the health center, still some miles away, doctors helped her to give birth safely. Because of the training Juan Pablo received from AMOS and the community's organization, we can give thanks to God that the woman arrived on time and there was a happy ending. It's worth mentioning that this woman is not even from the community of La Danta. She and her children were visiting her brother when labor started. The community responded regardless of where she had come from. An emergency required them to act out of love for their neighbor, and lives were saved. Next slide, please. So AMOS is called to accompany communities, even under challenging circumstances. We have been called as an organization to go and be in the places of most need. The successes in lowering the indices of preventable diseases and saving lives, creating healthy communities is not easy. Some challenges include long distances and lack of road infrastructure, cultural understandings about the roles of men and women, community organization and coordination with other agencies, and poverty. Next slide, please.
To share a personal story that brings faith and health together and show the servant leaders who make AMOS what it is, we see this time and time again that their motivation comes from a deeper place. We would like to tell you about Norlan Flores from the San Jose de la Mula community in the central mountainous region of Nicaragua. Norlan serves as member of the Community Health Committee and has been receiving training over the last 3 years to become a health promoter. He has learned to fill out the patient registry, take height and weight measurements of children, dispense basic medication, attend to patients in need with wound care, and be a substitute at the community clinic when the health promoter is away. When we ask what motivates him to serve, Norlan says, "What inspired me is my love for my community, for my family, for my people, for my neighbor." When we ask them what his favorite part of the work, he says, "Emergency care, first aid. I love being able to care for that person, offer them my trust, interact them in the midst of their difficulty. It is wonderful work because that person also feels trust for me and feels cared for." Next slide, please. Norlan also says, "I feel good doing this job. I feel confident. I know that I still have more to learn, but I feel that I am achieving my goals." It is easy to see the needs of people, and perhaps they do not have anyone to help them, like a person with a wound, a child with diarrhea. I do it not for my own benefit, but for the benefit of my people, in service for others, whether they thank me for it or not. That is what inspires me. As a health promoter, I will be able to do even more. Norlan is building his capacity as a result of the replication of knowledge. He's achieving his goal to support the current health promoter, and he's motivated by the faith values he learned in church and from his family, and combines his health training with that call to serve. Norlan embodies the success of AMOS' mission of health for all people. Next slide. We will close with some thoughts about where faith and health intersect and some lessons learned that could be applied to any context. A fundamental principle to bring faith and health together is to be willing to build relationships based on trust and mutual respect, whatever you are and whatever you are serving. That means listening well and trusting in the capacity of your partners in the mission of God Health, communities, institutions, donors, and being willing to learn and be transformed yourself in the process. Find ways to replicate your model. In the missionary world, we often says the best thing a missionary worker can do is to work for him or herself out of a job by building the capacity of others. Follow God's command to love your neighbor, build trust, and God will do great things. Next slide. Finally, our team in Nicaragua sends you greetings and wishes you God's blessing. Thank you. Next slide. You can learn more about the work of AMOS on our website, on Facebook, and our Instagram, or reach out to us. Muchas gracias. Thank you.
Thank you both to Dr. Wu and to Christy Lafferty for that great presentation. And as a reminder, if you have some questions, please put them in the Q&A box and we will get to as many of these as we can. We do have a couple of good questions in here to start us off with. The first one, I think, would be good for any of our speakers to answer. So maybe we'll give everyone a chance to answer this. This is from, let me see, the question is, there is long debate on religion and science of health where both stakeholders were misunderstood and break the bridge of opportunities to each other. how has this gap impacted the faith science community of practitioners and global partnerships? Dr. Dan, would you maybe like to answer that first?
Yeah, sure, Amy. Thanks. I think this is this possibly from Adamo Adise from
Yes.
Ethiopia? Okay.
Yes.
Yes, Adamo, thank you. Well, I think there is a gap for sure. There's different languages that are spoken in science and faith. And that's a gap that we are seeking to bridge. I think, and that's one of the purposes of this integration of faith and health working group. And also, the Christian Journal for Global Health, we seek to bridge those gaps. And I think the gaps can be narrowed when two things happen. When people of faith actually procure evidence, seek evidence, and I think it's Dr. Wu shared that part of AMOS's work, let's say, as a good example, is to look at evidence and say, what are outcomes and how do we measure that? But also, we shouldn't stop telling stories, because stories move people to action, and they move people to compassion and to motivation. Jesus spoke in parables, he spoke in stories, so we shouldn't just turn into data machines for the sake of the scientific community. But at the same time, I would say the scientific community in health and medicine and global health has become, I think, secularized in many ways. They don't look at the transcendent. So we would just ask them to look at the transcendent. And maybe create a spiritual sensitivity, and to realize that there are people of faith, and 80% of the population of the world has some religious faith. And so getting over this idea that secularism will take over the world, I think, is a failed premise. And so having, holding people up to the global goals, let's say, which is leaving no one out, which includes inclusiveness. So part of inclusiveness is including people of religious faith. Anyway, so those are just some things. And I appreciate the story from AMOS about the way the community responded. So I think when the gospel goes into communities, it transforms people from the inside out at the grassroots level. And it's almost like it's actually been likened to an immune system. Actually, with the whole global pandemic, there was a paper written recently about the faith community becoming like a little immune system, which activates during times of crisis and times of difficulty. And you can't put that in a bottle or inject it as and you can't make it into a policy, but yet it changes lives, it changes cultures, and it changes the course of history. So I think that maybe that answers the question there, Adam.
Thank you, Dr. O'Neill. That was a great answer to that question. And I think to keep things moving along and to get to as many questions as we can, I'm going to move on to the next question that we have here. And this one is for AMOS, so either Dr. Wu or Christy can answer this. Ronald Post asks, how do you think AMOS will evolve if and when external support leaves?
Yeah, thank you, Amy. Probably we will share responses. I know Christy will have something to say, but that's why we does not work alone. And if you remember from the presentation, that was the three-way partnership where the community is the base and the health system is who deliver directly the healthcare. So we are trying to work directly more with the system, with the health system, so that we can share our knowledge and our model. And our dream is that that will be incorporated in how the healthcare is delivered or being delivered by the health system.
Yeah, I don't know that I have much to add, just to say that I think that the key in investing and accompanying, training and supervising the local community leaders, encouraging their community empowerment and their capacity to respond to their own health needs is such a, and always has been, a key component of the work that we do. So we truly hope that capacity is built up so that even if an AIM at some point needs to leave the community, there is still that
Yes.
capacity there to respond.
Exactly.
Excellent. Thank you very much. Our next question, and we have a couple minutes for this, is from Joshua in Sierra Leone. Joshua asks, holistical health is indeed appropriate, good, and resonates quite a lot with the ministry of Christ. Does any of your services include the mental health and well-being of the people? Hence, health includes the physical, social, and mental. So I think maybe this is for AMOS as well. Is asking, do your services include mental health services?
Yeah, so we try to incorporate that aspect in all of our interventions. We have a good example. We have a program called Crianza con Amor, that is parenting with love. So when a mother or a caregiver is not in a good state of like in their emotions, they are not in the best position to care for their children or to help them to reach their development milestones. So we work that with the moms, the health component, and we have incorporated that into all of our educational materials too. And the idea is that in this holistic approach to health, we always include something that promotes mental health.
I think I'll just add very briefly that in addition to what Dr. Wu was mentioning, the motivation and foundation for our health promoters and our community leaders when we do, trainings with them, and we have devotionals, and our staff like having a focus on devotionals once a week. And we also have incorporated training and use of restorative practices into our work. And so all of that is kind of cross-cutting across what we do and tries to, really support that aspect, not just the mental health, but also spiritual health.
Spiritual health, yeah.
It's a great way to put that. Thank you. Another question that we have is, and it's this is from Mark Strand. And I think it actually was asked by a number of people. Also Lois Varenkamp. So kind of along the same questioning is, how do you negotiate the faith-based identity of AMOS with government collaboration? And I think that's something that, a lot of our organizations have to deal with, is the faith-based component with the government collaboration. So I'm hoping maybe both, Dr. Wu and Dr. O'Neill can answer this. So Dr. Wu, will give you a few minutes first.
I'm sorry for the noise. Yes, so even though we are a Christian faith-based organization, our flag is Health for All. So that means, and that is what has allowed us to work for everybody, or for anybody that needs healthcare, and specifically with the government collaboration, that and has not been any issue with us or with them, because at the end we are not striving for a particular population. We are striving for the community health and their well-being. So there has never been an issue, because that has always been like our main flag, to seek to heal the children of God's kingdom at a whole.
Thank you. And just very quickly, Dr. O'Neill, do you have anything to add to that as well?
Sure. Amy, I would just, actually, I'll fold this into that question that Laura Yoder had requested. You know, the government powers, you know, Jesus said, you know, render to Caesar what is Caesar's, render to God what is God's. The government powers are ministers in one sense for God, but also can be corrupted. Laura had asked about the, and actually, so when collaboration with governments, then we're actually collaborating with what God has instituted in many ways. And then we can speak into those government powers with hope and healing and some of the influence of the Christian faith. Laura asked about dynamos, the Greek word dynamic, we get the word dynamic from. So when the power that is given through the Holy Spirit to be able to overcome, to speak when we're brought before governors and agencies, not to worry about what we're going to say, and that the power of God is basically demolishes strongholds, or in the Greek it's logismos, which is ideas or thoughts or systems that are set against the will of God, and to take every thought captive unto Christ. And so when we witness,
that's a great way to end this, Dr. O'Neill.
Yeah.
Sorry, but we are running out of time.
Yep.
And I would like to hand this over to Jason, who can wrap this up for us. Thank you to all of our speakers today.
Thank you, everyone. We really appreciate your time and attention. I do want to just let you know that if you're interested, please connect with AMOS, and they shared their various opportunities to connect with them in social media. Dr. Dan O'Neill has a book, All Creation Groans. If you do want to learn more about theology of disease and global health, a lot of great content that he's put together in that book, and thank you for doing that and authoring that with Beth Snodderly. Also, if you want to join the Integration of Faith and Health Working Group, please do so. We'd love to have your membership. You can inquire about becoming a member of CCIH on the website, and the link will be placed in the chat box for you to investigate becoming a member if you're not already. If you are a member, you want to join, you can contact Hannah Fields and she'll get you connected. Our next meeting is June 1st, 9 to 10 Eastern time. We look forward to seeing you there. If you want to integrate with our group, it's a great time to continue talking about this concept of the integration of faith and health. So with that, I'm going to end us and just really thank you for joining us today. Blessings in your day. Go with Jesus.